Hello everyone and welcome to Module 5, Basic Control Factors for Controlling COVID-19. The learning objectives for this module is to cover what to do when COVID-19 symptoms are shown, how to maintain social distancing, utilizing face coverings properly, and then important factors for hand and respiratory hygiene. And the overall disclaimer that I want to add to this is at this point in the pandemic, we do have Americans who are taking COVID-19 vaccines, and the vaccine rollout is continuing to advance. So that being said, the guidance from the CDC will be changing, and we suspect it will be changing rapidly. So just keep in mind that we don't hit very hard on vaccines during this module, but we do know that this can change how we do enforce mitigation practices. So let's kick things off for what to do when symptoms are shown. So quick review, what are the symptoms? Well, there's definitely a lot of them, and they can vary in severity. So going through this list really quickly, we have fever and chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, the new loss of the sense of taste or smell, having a sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. And we know that you may experience one or two of these, many of them, or for some people who are asymptomatic, they may never experience really any of these symptoms at all. So the spectrum really varies on how severely people show symptoms of COVID-19. So what do you do when these symptoms? As an individual, do not come to work and make sure that you stay home. So you want to contact your medical provider and your employer for further guidance at that point. Because if you do show symptoms, your employer is not going to want you running the risk of having other people exposed to you and losing even more of their workforce due to that exposure. So it's best if you communicate with both your doctor and your employer on next steps. And then from an employer standpoint, so from a management standpoint, there's going to be more information in Module 6 on proactive mitigation strategies to talk about this. So if you have been exposed to someone who has tested positive for COVID-19, bottom line is don't come to work yet and inform your employer. So whether you show symptoms or if you know that you've been exposed to someone, in either case you want to let that person know. So quick review here from previous modules. We know for sure the primary vector of transmission of COVID-19 is through those respiratory droplets, and prolonged close contact is also a direct mode of transmission. So between the primary respiratory droplets and being in close proximity to somebody, those are your more direct routes of transmission, whereas things like touching a contaminated surface is a less direct route of transmission. So this would be more of an indirect route. So what we really want to focus on is limiting those primarily respiratory droplet transmission cases and close contact cases, because that's where we're going to get the most in our book. As far as social distancing goes, so the best way to avoid contracting the virus is to avoid exposure. So to do this, I'm sure over the past year plus, you've heard about staying at least 6 feet from other people who are not in your household. And this can include indoor and outdoor spaces, and again, guidance is evolving here on what you can do if you're fully vaccinated or not. But generally 6 feet is the guideline for physical distancing or social distancing. And it's important to note here that people can spread the virus before they know they're sick. So even if you want to get together with somebody and they say, I feel fine, how do you feel? And you say, I feel fine. That's not a guarantee that that's not a potential mode of being exposed. So that's where the social distancing becomes really important, even if you or the person you are near does not have any symptoms. The next thing I want to talk about is utilizing face coverings properly. So just a quick note here, face coverings are not a substitute for social distancing. So these are two separate mitigation practices that, when used together, are the most effective. So masks can help prevent people who have COVID-19 from spreading the virus. So the intention of the mask isn't to necessarily keep you as the mask wearer safe, but it is the intention of the mask to make sure that you, the mask wearer, are not unintentionally spreading that virus to somebody else. So that's the primary purpose of that face covering. So masks are most likely to reduce the spread of COVID-19 when widely adopted by people in public settings, and they're most effective if correctly implemented, in addition to that social distancing and proper hygiene practices, which we'll talk about coming up here. So when you're selecting a mask, at this point in the pandemic, you may have had experience with various styles of masks, but things that you want to think about. You want to make sure that you're not choosing a mask that's made of fabric that makes it hard to breathe. So you want to be comfortable, or else you're going to be fiddling with your mask quite a bit. So you don't want to be wearing the vinyl face mask, for example. You also want to avoid masks that have the exhalation valves or vents, because that actually allows the virus particles to escape, and that does not work towards the purpose of the mask in general. So avoid those masks that have those valves or vents on them. Do not choose the mask that is intended for a healthcare worker, including N95 respirators or surgical masks. And then a quick note on face shields. There's a gap in scientific data on face shields, so right now the recommendation is to stick with that face mask. Do select a mask that has 2 or more layers of washable, breathable fabric. So, when you're picking out a mask, you can tell how many layers of fabric that has, and you want to aim for 2. Select a mask that fully covers your nose and mouth and fits snugly against the side of your face and doesn't have gaps. And I'll also add here that if you find a face covering that you like, then it might be wise to invest in a couple of these, because you want to remain comfortable. And the more comfortable your mask is, the more easy it is to wear that throughout the day. So steps for wearing your face covering properly: wash your hands before putting on a face covering, put it on over your nose and mouth and secure it under your chin. Make sure it fits as snugly as possible against the sides of your face, and make sure that you can breathe easily. And then avoid touching your face with unwashed hands after putting on the face covering. And this is where finding a comfortable mask becomes important, because you don't want to be touching your face, adjusting that mask constantly. And then avoid pulling the face covering up on your forehead or down around your neck. So I know some things that we see in facilities are, for example, it's hard to hear. So when you talk, sometimes your instinct is to pull down that face covering when you're trying to hear somebody. But that's the exact type of thing that you want to avoid. So that's something to think about from a managerial standpoint. Maybe there's been some success with facilities purchasing like walkie-talkie or headphone speaker systems, where you don't have to struggle to hear people in a loud facility while you have a face covering over your mouth. So people are thinking outside the box a little bit to help make face coverings an effective tool and make it as easy as possible for employees to adopt wearing face coverings properly. So as far as other guidelines go, if you're using a cloth face covering and not a disposable one, you should wash your face covering regularly based on the frequency of use, or as soon as it becomes damp. So you can include your mask with your regular laundry, use your regular laundry detergent and preferably warm water, and then use the highest heat setting and leave your face covering in the dryer until it's completely dry. And I mentioned those disposable face coverings, and just a note on those, single-use face coverings means single use. So make sure you're disposing of those and getting a new one where appropriate. All right, important factors for respiratory and hand hygiene. So though respiratory droplets are the primary vector of transmission, as we discussed, those direct routes, we also want to avoid transmission through contaminated surfaces. So we know that the virus is not as easily transmitted through surfaces because the series of events is just a little bit makes it more difficult for the virus to reach you. So someone would have to cough and sneeze, and then have those particles get on their hand. Then they'd have to touch the door handle, and then you're dealing with the transfer rate of how much of that virus got from your hand to the door handle. And then the virus starts to inactivate as soon as it doesn't have a host. So before that virus inactivates, someone else would touch the door handle, and then that person would then need to touch their face, so their eyes, nose, or mouth, for the virus to actually infect them. So the series of events is just a little bit more challenging there. But that being said, proper hand hygiene is a very realistic way to limit that risk. So in a food facility, the practice of frequent hand washing limits that vector of transmission. So as far as respiratory hygiene goes, if you do have to cough or sneeze, follow the basics. Always cover your mouth and nose with a tissue or the inside of your elbow, and then immediately wash your hands with soap and water for at least 20 seconds. So this is not necessarily anything new, but definitely reinforcing proper respiratory hygiene to help protect others. And then just a note on this practice, if you're in a food facility, if you have to touch your face, or if you cough or sneeze, the best practice here and the good manufacturing practice here is to immediately wash your hands with soap and water for 20 seconds. And that's part of good manufacturing practices, and that's what all people in food facilities should be doing. And this is true pre-COVID-19, but it certainly is true from a personal hygiene standpoint during this pandemic as well. And then avoid touching your face with unwashed hands. So the eyes, nose, and mouth are the potential entry sources for SARS-CoV-2. And proper hand washing before touching the face is a key way for individuals to protect themselves from becoming sick. So as far as protecting yourself goes, washing is a good practice. All right, so as far as frequent hand washing goes, more on that. SARS-CoV-2 has a lipid membrane easily disrupted by soap, and that inactivates the virus. So we know that washing hands is effective. So it is important for breaking the potential transmission route of frequently touched surfaces. Hand washing sinks should be readily available to food processing employees. Hands should be washed before and after touching your face, so your eyes, nose, and mouth. And gloves must also be changed frequently so as not to become a potential transmission vector. So just because you're wearing gloves doesn't mean that you can touch something and then go touching your face and touch something else. Those gloves need to be changed so that they're not a transmission vector. And again, these 4 bullets are not new because of COVID-19. These are all good manufacturing practices that should have been in place before the pandemic, but we know that it's human nature that things do get missed, so we want to make sure that we're circling back and making sure we're working with folks in facilities to be following these proper hand hygiene practices. As far as hand sanitizers go, related to COVID-19, alcohol-based hand sanitizers that contain 60% alcohol can be used, but that's only effective on hands that are not visibly soiled. So the idea here is that ideally you'd want to wash your hands first so that your hands are clean from a visibility standpoint, and then you could apply that hand sanitizer for the sanitizing process. So it should not be used as a substitute for washing hands with soap and water, but if you're, let's say, outside of the food facility, or the processing area, let's say you're out and about, and you don't have quick access to soap and water in a hand washing sink, that's when alcohol-based hand sanitizers can be used without washing your hands first. But just to note that it's not a substitution for hand washing itself. And then also a note on vaccination. So I mentioned at the beginning that the vaccine rollout is happening, and we know that vaccines are very effective at preventing COVID-19. the development of COVID-19 symptoms, and the need for hospitalization, and the likelihood of a person dying because of COVID-19. So in general, the recommendation is that, yes, we know vaccinations are effective against the virus, and we want people to get vaccinated to achieve this herd immunity. In the meantime, information is continuing to emerge on how effective vaccinations are at preventing transmission of the virus from person to person. So therefore, the recommendations are still evolving. In fact, as I'm recording this, I'm expecting more guidance to come out of the CDC today. So again, this module will be posted online, and we just want to make sure that if you are making guidance for your individual facility, that you are checking the most up-to-date information for recommendations from a CDC standpoint based on the information we have. So again, as more people get vaccinated, the number of daily cases will be further reduced, and we'll get more data on those vaccines. And we'll be able to gradually loosen recommendations, but for now, it really is too soon to make those kinds of decisions or recommendations, specifically for a work environment where we may have various amounts of vaccine adoption. So just keep tuned there, and more information will be coming out as time goes on. In the meantime, the learning objectives from this module, key points to take home are: stay home when you have symptoms. Social distancing is certainly a key way of controlling the virus. Face coverings are an important tool to mitigate the primary vector of transmission. So between social distancing, face coverings, and then frequent hand washing and practicing proper respiratory hygiene, we know for sure those are effective mitigation practices to help reduce COVID transmission. So keep 6 feet apart as a way to practice social distancing. Wear and replace your face coverings. Screen yourself for COVID-19 symptoms. Practice frequent hand washings, and avoid touching your face with unwashed hands. And that being said, thank you for tuning into Module 5, and we hope you tune in to the next module.